For today's Health in Focus, we are talking about aneurysms. We've got board-certified neurosurgeon Dr. Jay Jaganathan here to talk about them. So tell us, first off, what is an aneurysm?
An aneurysm is an outpouching of one of the blood vessels. In this case, it's an outpouching of a blood vessel going to the brain. And when there's a weakness in the wall and the vessel can pouch outwards, there's a higher risk of bleeding or breaking of the vessel that can cause potentially life-threatening bleeding into the brain.
Okay. So how do you diagnose this, and then where do you go for treatment?
So there are two ways that we generally find aneurysms, and they're two different types. One are unruptured aneurysms, which means the aneurysms haven't bled, and those are actually more common than what a lot of people would think. It's probably in the order of something about 50 patients out of every 1,000 or so in the United States. And usually those are diagnosed based on symptoms such as headaches or not feeling right. Sometimes they can push on nerves that are controlling vision and other nerves in the brain, and can be diagnosed. Those tend to have a family history. So a lot of times now patients with a strong family history, meaning first-degree relatives like a parent had one, that it's important for children to be screened. The other way you notice this is when the aneurysm bleeds, which is obviously much more serious. And in those cases, patients oftentimes present with stroke-like symptoms, weakness, severe headaches are common, loss of consciousness, things like that.
Okay. And so if you catch it before it bursts, what kind of treatment options do you have there?
So there are three broad ways of treating it. The first, in case of very small aneurysms, especially when a patient has good follow-up, they can be observed. A lot of times aneurysms are found incidentally, and they don't necessarily need to be treated other than just observation, and that's especially the case in extremely small aneurysms or aneurysms that might be in a very delicate location. The other option, the more traditional option, is what's called a clipping of the aneurysm, which means that you do a craniotomy, which is a surgery where you open up the skull and you put a clip across the neck of the aneurysm. And that is said to be the most durable treatment, because once you put the clip across, the aneurysm is fully treated in many cases. And the third option, which is increasing in popularity, especially over the last 15 years or so, is endovascular treatment, which is where you go in through the blood vessel. So it doesn't require an open surgery, but where you put coils into the aneurysm that eventually clot off and obliterate the aneurysm. But there is a risk of aneurysm rupture during the period where it's not fully clotted off.
Okay. And obviously, if there is a rupture, then, I mean, that's emergency room, right?
Yeah. So the classic symptom that patients have with the ruptured aneurysm is when someone complains of the worst headache of their life. It's called a thunderclap headache, where you're feeling okay and then suddenly the headache comes on. Usually the recommendation is to go to the emergency room. The gold standard for diagnosis is a CAT scan, which will show you if there's blood. There are more advanced studies such as a CT angiogram or an angiogram that will give you a delineation of the blood vessels in the brain and to see where the aneurysm is coming from. Once the aneurysm is treated, especially if it bleeds, there is a higher risk of stroke during the 2 to 3 week postoperative periods, because the blood vessels in the brain tend to spasm, and that can be sometimes have a higher morbidity than even the aneurysm rupturing itself. So it is important to get to these aneurysms before they bleed and to know you have one if it's there, because it can put a patient at risk if it does rupture.
Absolutely. Okay, a lot of information there. If you want to learn more, you can always head to our website. Thank you so much, Dr. J. Just go to 9and10news.com if you'd like to learn more about brain aneurysms.
This Health in Focus is a paid segment by Jaganathan Neurosurgery.